So the topic for my class today is cavity nomenclatures and terminology commonly used in the operative dentistry. So the contents that I'll be dealing with is introduction and the nomenclatures and terminology. So a nomenclature refers to a set of terms used in communication by individual in the same profession that enables them to understand one another better. So there are several terms and terminologies used in the operative dentistry. So one must familiarize with the different nomenclatures before doing the cavity preparations. So the first is the nomenclatures that are related to the cavity preparation. So the first is the nomenclature of that is the definition of a cavity. It's defined as it refers to a defect in the tooth enamel or in both enamel and dentin due to the carious process. While cavity preparation means defined as it refers to the mechanical alteration of a defective, injured or diseased tooth to receive a restorative material which will re-establish the normal form, function and aesthetics of the tooth. So a simple cavity preparation. So this terminology means that the cavity preparation that involves only the one tooth surface, that is, for example, an occlusal cavity preparation. A compound cavity preparation means a cavity involving two surfaces, that is, for example, that is the mesial and the occlusal surface, that is, two surfaces are involved. A complex cavity preparation refers to cavity involving three or more than three surfaces on the tooth. That is, an example is the MOD cavity involving mesial, occlusal, and the distal cavity preparations. So it can be referred to as, for ease of communication, we can shorten as occlusal for O, mesial and occlusal for a MO, and if distal is involved, we can term as MOD for a ease of communication. So the term intracoronal cavity refers to cavity operation that is within the interior surface of the tooth. That is a cavity that is involving within the tooth surface. And another term is extracoronal tooth preparation. That is tooth preparation involving the external surface of the tooth, which mostly limits to the enamel surface. An example is a tooth crown preparations. And next is the terminology related to the walls of the cavity preparation. So in surface of a prepared cavity, that is within the internal surface of the tooth, is known as a wall. So there are basically two types of walls. That is, the first is the internal wall and the external wall. And within the internal wall, there are two types. That is the axial wall and the pulpal wall. So an internal walls means it's the surface of a prepared cavity that is within the inside the tooth and does not extend into the external tooth surface. So there are two types of internal walls. That is, firstly the axial wall, which is parallel to the long axis of the tooth, and pulpal wall, which is an internal wall perpendicular to the long axis of the tooth. So these two are the internal walls, that is the pulpal wall and the axial wall. Pulpal wall, it is perpendicular to the long axis, while the axial wall is parallel to the long axis. So these two walls are within the prepared cavity. And the external wall means it's a prepared surface extending onto the external tooth surface. That is, there is a communication with the external tooth surface. And the name of the wall takes the tooth surface that the wall is toward. Example is facial, mesial, distal, lingual, and gingival walls. That is the walls that is connecting with the external walls. That is known as the external wall. That is the towards the external tooth surface. That is the external wall. And next is the floor or the seat of the cavity, referred to a prepared cavity that is slightly flat and perpendicular to the opposite forces that along the long axis of the tooth. Example is pulpal and gingival walls. This is in the floor of, that is a gingival wall. So next terminology is the enamel and dentinal wall. Enamel wall basically means the portion of the prepared cavity which contains the enamel, and dentinal wall is the portion of the prepared wall composed of dentin. And the another terminologies are the angles in the cavity preparation. So there are two types, that is the line angles and the point angles. So a line angle is the junction of the cavity wall that is formed by two planar surfaces oriented in different orientation. And point angle is the junction of three walls in the cavity preparation. So the corners of the cavity is known as the point angles, while the line angles are the angle formed by the two planar surface, while point angles is the area that is formed by the three surfaces at different orientation. Another term is the cavo-surface angle, refers to the angle of the tooth structure formed by the junction of the prepared wall and the external tooth surface. That is the external tooth surface and the prepared wall, the angle formed by the junction of these two is known as the cavo-surface angle. And the cavo-surface margin is the actual junction of the prepared wall and the external tooth surface. It is known as the cavo-surface margin. Then other terminologies are the junctions. That is, the two types are dentino-enamel junction and the cemento-enamel junction. Dentino-enamel junction is basically the junction between the enamel and dentin, while cemento-enamel junction where the enamel and the cementum meeting. So this is known as the cemento-enamel junctions. So these are the common terminologies that we come across the when dealing with the operative dentistry, where one should be familiarized with.